Welcome to the SDSU Narcan training. This training will cover what naloxone and Narcan are, what opioids are with an emphasis on fentanyl, how Narcan works, how to use it, how to respond to a suspected opioid overdose, and the importance of bystander intervention to save a life. You'll also have the opportunity to consider your safety plan. Naloxone is a medication used for known or suspected opioid overdoses in adults and children. It is intended for immediate use in emergency situations where opioids may be present. Naloxone is not a replacement for medical care, and 911 should always be called as soon as possible in the event of a suspected overdose. Naloxone is an effective treatment for opioid overdose and is available in 3 forms. 1. An injectable that requires a trained professional to administer. 2. An auto-injectable. This product is called NZO. It is injected into the thigh similar to an EpiPen. Or 3. A pre-packaged nasal spray. The nasal sprays are pre-filled, needle-free, and require no assembly. Narcan is a well-known version of this type of nasal spray and is very easy to use. You may occasionally also hear this type of naloxone referred to as Cloxidil. At SDSU and in San Diego and Imperial counties, Narcan is a more commonly available form of this nasal spray, so we will be using the term Narcan during today's presentation. You will be provided with instructions on how to access Narcan at no cost at the end of this training. What are opioids? Opioids are natural, synthetic, or semi-synthetic chemicals that interact with opioid receptors in the brain. Opioids reduce the intensity of pain signals and the feelings of pain. Types of opioids include prescription opioids like morphine, hydrocodone, and oxycodone, synthetic opioids such as fentanyl, and illegal drugs such as heroin. Let's take a moment to discuss fentanyl. Fentanyl can be fatal even in extremely small doses. It's an opioid that's up to 50 times more potent than heroin. Fentanyl has increasingly been found mixed into cocaine, heroin, meth, and counterfeit pressed pills posing as Xanax, ecstasy or Molly, oxycodone, and Adderall. More than 70,000 people died from fentanyl overdoses last year who may have never intended or knew they were being exposed to the substance. Sometimes, even when individuals thought they had obtained pills that were safe by purchasing them at a pharmacy in another country, they were exposed to fentanyl. This is why officials urge that people never take substances unfamiliar to them or from someone they do not know. For instance, a recent UCLA study of pills obtained at a sampling of 40 pharmacies in northern Mexico found counterfeit pills were obtained at 27% of the pharmacies. Of the samples sold as one-off controlled substances, 20 were counterfeit, including almost 82% of samples sold as Adderall contained methamphetamine. Just over 29% of samples sold as oxycodone contained fentanyl. 3 oxycodone samples contain heroin. The best way to ensure pills, in particular, are fentanyl-free is to obtain them from a prescription filled by a U.S. pharmacy. Prescription legitimacy cannot be guaranteed when purchased from a foreign country. It is important to emphasize again that fentanyl can be fatal in very small doses. Oftentimes, just 2 milligrams is enough to kill most people. This is just 0.002 grams. Take a moment to pause the video and review this graphic. Fentanyl overdose almost always occurs from exposure due to ingestion, injection, or inhalation. Please note that overdose due to directly touching fentanyl is very uncommon. If you think you have been exposed to fentanyl, do not touch your eyes, nose, or mouth. Wash your hands with soap and water to remove any substance from your hands. If you begin to experience any adverse reactions, call 911 immediately. Now let's spend some time talking about Narcan. Narcan can be used to reverse opioid overdose. Narcan is contained in a small white device about 2 inches long. The device delivers an intranasal naloxone spray and is for use in the nose only. Each individual device is considered 1 dose, and each box contains 2 doses. How exactly does Narcan work? Remember that Narcan is a specific type of naloxone administered as a nasal spray. Naloxone is an opioid antagonist used specifically to reverse the effects of opioids. Put another way, naloxone stops opioids from binding to opioid receptors in the brain, thus stopping an overdose. The effects of naloxone last about 30 to 90 minutes. Narcan can easily be administered by lay people, in this case you, a friend, a roommate, or a family member. However, it's important to note that Narcan nasal spray is not a substitute for emergency medical care. Always call 911 if you think someone is experiencing an overdose. There are state and university policies in place to support bystander intervention and encourage individuals to take action in a health emergency. Narcan administration is covered under the state of California's Good Samaritan Law. It is considered as rendering first aid similar to CPR. SDSU also has an amnesty policy which supports individuals and a Good Samaritan policy which supports recognized student organizations. Both policies strive to make clear the responsibility of students in the event of an emergency, encourage students to take appropriate action, and ensure that individuals and organizations who take appropriate action are supported and not met with formal disciplinary sanctions for reporting the incident. At SDSU, the only individuals who are required to administer Narcan as part of their jobs are those individuals who work as healthcare professionals, such as the team at Student Health Services, or those who are identified as first responders like university police. However, all members of our community are encouraged to be good bystanders and call for emergency help or support and administer Narcan if you are comfortable doing so during a suspected opioid overdose, just as you might use an AED and call 911 if someone were experiencing a suspected heart attack or cardiac event. It is also important to note that Narcan is not a controlled substance and doesn't get people high. Narcan should still be administered if the suspected overdose is due to a combination of opioids and other drugs. As the FDA has shared regarding Narcan, naloxone works in the brain only, binding to the opioid receptors and blocking the effects of opioids. If someone is having a medical emergency other than an opioid overdose, such as a diabetic coma or a cardiac arrest, giving them naloxone won't have any effect or cause them additional harm. Stated another way, it can't hurt the unconscious individual even if you're not certain they are experiencing an opioid overdose. If you encounter someone who is unresponsive and you suspect an overdose, first shake their shoulders, shout their name, and ask if they are okay. Check for visible signs of an overdose. This can include them being unresponsive to touch or voice, their breathing has slowed, it may even be uneven or has stopped completely, snoring or gasping sounds, or fingernails or lips are blue or purple. Administer Narcan as quickly as possible if someone is unresponsive and an opioid overdose is suspected. Remember to call 911 as soon as possible. Notify them that you have administered Narcan, update them on the person's condition, and stay by the person's side until help arrives. Now, I'd like you to take a moment to watch this short video on how to administer Narcan.
Narcan nasal spray is not a substitute for emergency medical care. As with any drug, you need to be aware of important safety information concerning its use. Please see indications and important safety information at the end of this video. Also, please see accompanying full prescribing information in the use of this product. Narcan nasal spray is an emergency treatment for a known or suspected opioid overdose. The appropriate use of Narcan nasal spray can help you save a life. Narcan nasal spray is not a substitute for emergency medical care. As with any drug, you need to be aware of important safety information concerning its use. If you encounter someone who is unresponsive and you suspect an overdose, first shake their shoulders and shout their name.
Kevin.
Ask if he or she is okay.
Hey, can you hear me?
Check for signs of an overdose, unresponsive to touch or voice. Breathing is slow, uneven, or has stopped. Snoring, gasping, or gurgling sounds. fingernails or lips are blue or purple. Administer Narcan nasal spray as quickly as possible if someone is unresponsive and an opioid overdose is suspected, even when in doubt, because prolonged respiratory depression may result in damage to the central nervous system or even death. Lay the person on their back to receive a dose of Narcan nasal spray. Remove Narcan nasal spray from the box. Peel back the tab with the circle to open it. Remove and review the printed quick start guide inside the package. Hold the Narcan nasal spray with your thumb on the bottom of the plunger and your first and middle fingers on either side of the nozzle. Do not press the plunger to test or prime the device. If you do, you will waste all or part of the dose of medication. Tilt the person's head back and provide support under the neck with your hand. Gently insert the tip of the nozzle into one nostril until your fingers on either side of the nozzle are against the person's nose. Press the plunger firmly to give the full dose of Narcan nasal spray. Remove the device from the nostril after giving the dose. After you have given this medication, seek emergency help right away. Narcan nasal spray is not a substitute for emergency medical care.
I'm with somebody who stopped breathing. I think they've had an overdose.
Move the person on their side after giving Narcan nasal spray. If possible, put their hands under their head and bend their upper leg forward. This helps prevent the person from rolling onto their stomach. This is known as the recovery position. Continue to watch the person closely. If they do not wake up or respond to your voice or touch, or if they do not seem to be breathing normally within 2 to 3 minutes, use a new Narcan nasal spray to give an additional dose in the other nostril. Acute opiate withdrawal symptoms may occur from use of Narcan nasal spray in patients who are opioid dependent. Symptoms include body aches, diarrhea, increased heart rate or tachycardia, fever, runny nose, sneezing, goosebumps, also known as piloerection, sweating, yawning, nausea or vomiting, nervousness, restlessness or irritability, shivering or trembling, abdominal cramps, weakness, and increased blood pressure. When the emergency is over, put the Narcan nasal spray back in its box and throw it away in a place that is away from the reach of children. In addition to watching this video, please read the quick start guide that comes with Narcan nasal spray before using it. Talk to a healthcare professional if you have any questions about how to administer Narcan nasal spray. Please read the indications and important safety information that follows. Store Narcan nasal spray at room temperature between 59 to 77 degrees Fahrenheit, 15 to 25 degrees centigrade. Do not freeze Narcan nasal spray. Keep Narcan nasal spray in the box until ready to use. Protect from light. Replace Narcan nasal spray before the expiration date on the box. Keep Narcan nasal spray and all medicines out of the reach of children. Indications: Narcan naloxone hydrochloride nasal spray is an opioid antagonist indicated for the emergency treatment of known or suspected opioid overdose as manifested by respiratory and/or central nervous system depression. Narcan nasal spray is intended for immediate administration as emergency therapy in settings where opioids may be present. Narcan nasal spray is not a substitute for emergency medical care. Important safety information: Narcan nasal spray is contraindicated in patients known to be hypersensitive to naloxone hydrochloride. Seek emergency medical assistance immediately after initial use, keeping the patient under continued surveillance. Risk of recurrent respiratory and CNS depression. Due to the duration of action of naloxone relative to the opioid, keep the patient under continued surveillance and administer repeat doses of naloxone using a new nasal spray with each dose as necessary while awaiting emergency medical assistance. Risk of limited efficacy with partial agonists or mixed agonist-antagonists. Reversal of respiratory depression caused by partial agonists or mixed agonists-antagonists, such as buprenorphine and pentazocine, may be incomplete. Larger or repeat doses may be required. Precipitation of severe opioid withdrawal. Use in patients who are opioid dependent may precipitate opioid withdrawal, characterized by body aches, diarrhea, increased heart rate, tachycardia, fever, runny nose, sneezing, goosebumps, piloerection, sweating, yawning, nausea or vomiting, nervousness, restlessness or irritability, shivering or trembling, abdominal cramps, weakness, and increased blood pressure. In neonates, opioid withdrawal may be life-threatening if not recognized and properly treated, and may be characterized by convulsions, excessive crying, and hyperactive reflexes. Monitor for the development of opioid withdrawal. Risk of cardiovascular, CV, effects. Abrupt postoperative reversal of opioid depression may result in adverse CV effects. These events have primarily occurred in patients who had pre-existing CV disorders or received other drugs that may have similar adverse CV effects. Monitor these patients closely in an appropriate healthcare setting after use of naloxone hydrochloride. The following adverse reactions were observed in a Narcan nasal spray clinical study: increased blood pressure, musculoskeletal pain, headache, nasal dryness, nasal edema, nasal congestion, and nasal inflammation. See instructions for use and full prescribing information in the use of this product. To report suspected adverse reactions, contact Adapt Pharma Inc. at 1-844-4-NARCAN, 1-844-462-7226, or the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch.
Calling 911 is an essential step in responding to a health emergency. Local police and EMS, including SDSU University Police, carry naloxone and can provide and administer additional doses if the person with the suspected opioid overdose is not improving. Remember that Narcan only addresses opioid-related health concerns. The individual could also be experiencing alcohol poisoning or issues related to other substances such as stimulants, sedatives, or emerging synthetic substances such as xylazine, which is a non-opioid veterinary tranquilizer not approved for human use that has been linked to an increasing number of overdose deaths nationwide. Now let's talk about where to store Narcan. You should store Narcan at room temperature between 59 degrees and 77 degrees. Never freeze your Narcan, and keep your Narcan in the box until you're ready to use it. Always protect it from light. Replace Narcan before the expiration date on the box, and always keep Narcan and all medications out of the reach of children. The first step of developing your safety plan is to consider where you plan on keeping your Narcan. Make sure your Narcan is in an easily accessible, unlocked location, such as a desk drawer or a medicine cabinet. Confirm that your roommates, housemates, or friends know where it is. Also consider the following facts if you plan on taking Narcan on the go. Ensure that you keep the device in the original hard plastic container until it needs to be used. The container is designed so that the medication isn't accidentally discharged or wasted. We recommend transporting Narcan in a backpack or bag and not in one's pants pocket. Do not store Narcan in your car's glove compartment. Remember that Narcan needs to be stored at room temperature, and cars typically get hotter than the reported outside temperature. It is safe and legal to fly with Narcan in your carry-on luggage. So what are some possible side effects? There are actually little to no side effects associated with the actual Narcan medication. However, Narcan should not be used on people known to be allergic to naloxone hydrochloride, the active ingredient in Narcan. People may experience opioid withdrawal after Narcan is administered if they are a frequent opioid user. Let's also take a moment to talk about fentanyl test strips. Fentanyl test strips are one additional tool in helping to prevent opioid overdoses. These test strips are small test strips that can detect the presence of fentanyl in different kinds of drugs. They help to provide important information about fentanyl in a drug supply to help prevent overdoses. Each fentanyl test strip works a little bit differently, but for most of them, you will mix a small amount of the drug being tested with water, place the test strip into the water, let it absorb for a short period of time, and then read the test strip. These tests are similar in nature to at-home COVID tests, so they are easy to use and read. Please review instructions provided with the test strip to accurately complete testing. An important note about fentanyl test strips is that they are not a perfect detection method for the presence of fentanyl in a drug. Just like this graphic illustrates, one portion of a drug may contain fentanyl, while another portion may not. These test strips are just one tool in helping to prevent overdoses. Fentanyl test strips are available for students at the SHS pharmacy at no cost after completing this training. They can also be purchased through reputable online retailers. Students may access a limited supply of Narcan or fentanyl test strips through Student Health Services during business hours after completion of this training. Students can also access these items 24 hours a day using the Health and Wellness Supplies vending machine outside the pharmacy. These supplies are also available for purchase at local pharmacies or reputable online retailers. You may also be able to access supplies when attending major concerts or festivals. Students can also find Narcan and red overdose emergency kits throughout campus. These are located in all residence halls, typically in the main lobby or community lounge. These kits are also located in the SDSU library in both San Diego and Imperial Valley, and in community spaces such as the Student Union on both campuses, the Aztec Recreation Center, and Viejas Arena. As we wrap up this training, we want to quickly remind you of the most important things you can do to keep yourself or a friend safe. Always have someone with you who isn't using who could administer Narcan or call 911 if needed. Call 911 if someone experiences a health emergency. Narcan starts to reverse the overdose to allow time to get that person connected to the life-saving emergency care they need. Only use medicines that you're certain came from a U.S. pharmacy. Do not drive or do other risky activity after using drugs. If you're leaving California or the United States, know the laws around Narcan where you're going. Different locations have different regulations around carrying this medication. If you have any questions at the conclusion of this training, please contact SDSU Wellbeing and Health Promotion by emailing whp@sdsu.edu or by stopping by their office located on the 3rd floor of the Calpulli Center. Now that you've watched this video, please complete the following assessment to complete this training. For our currently enrolled students, you will be eligible to obtain Narcan at no cost from SDSU upon completion of the assessment. After completion, you will be provided with instructions on how to pick up Narcan at your convenience.